Welcome to the Deep Dive. Today we're taking a stack of sources provided by you, our listener, and plunging into the fascinating, complex, and sometimes contradictory world of N-Acetylcysteine, better known as NAC.
That's right.
You might have encountered NAC in surprising places, maybe listed as a supplement for athletes, discussed for its potential anti-aging properties, or recognized as a critical life-saving medication. How can one single compound seem to do so many different things, often with wildly varying results reported in the research?
Well, that paradox, the sheer breadth of its applications alongside the often mixed clinical findings, is precisely what makes NAC such a compelling subject for a deep dive. It really forces us to look closely at the underlying science and, the nuances of the research itself.
Exactly. So guided by your sources, which include foundational review articles and specific research studies, looking at everything from cellular mechanisms to athletic performance and diverse medical uses, our mission today is to extract the most important nuggets of knowledge and surprising facts.
Yep, we're digging in.
We're going to unpack what these materials tell us about NAC, guiding you through the landscape they present. Okay, let's unpack this.
Right. So to understand NAC's wide-ranging effects, we absolutely have to start with its foundation, what it is and how it works at a molecular level, drawing from those review articles you provided. At its core, N-Acetylcysteine is a modified form of a relatively simple amino acid called L-cysteine.
Amino acids are the building blocks of proteins, right? So cysteine is just one of those fundamental pieces.
That's right. But cysteine has a particularly crucial role because it's one of the key ingredients the body uses to make something called glutathione, often abbreviated as GSH. Think of GSH as your body's chief internal antioxidant and cellular handyman.
I have definitely heard glutathione called the master antioxidant. Is that just hype or?
Based on the sources, that description isn't far off the mark, actually. GSH is the most abundant intracellular free thiol. That thiol part refers to a specific chemical group containing sulfur and hydrogen, often written as SSH. This SSH group is critically important for its function. And GSH is central to maintaining cellular redox balance.
Redox balance. Okay, layman's terms, please. What are we talking about?
Okay, imagine your cell is like a tiny factory, constantly generating energy and doing work. As a byproduct, it produces these waste products, or sparks, called reactive oxygen and nitrogen species, RONS.
Right, free radicals and that sort of thing.
Exactly. These RONS in excess can damage cellular machinery. Think of them as tiny vandals inside the cell. Redox balance is like keeping the factory clean and safe by neutralizing these vandals.
Makes sense.
And GSH is a major player in that cleanup crew. Low GSH levels are linked to oxidative stress, which is like letting the vandals run riot. And that's associated with a long list of problems, from various diseases to, well, the aging process itself.
Okay, so GSH is super important for keeping cells healthy by managing these damaging molecules. And NAC helps the body make GSH. Why can't you just take GSH directly as a supplement? I see that around sometimes.
Yeah, that's a key point the sources highlight. Pure GSH, when taken orally, has notoriously low absorption and effectiveness because it gets broken down pretty badly in the digestive system. So supplementing with NAC is a primary, very effective strategy to increase GSH levels inside cells where it's needed most.
Okay.
NAC provides that crucial cysteine building block that is often the limiting factor, the bottleneck in making more GSH.
Got it. It's like giving the factory the specific raw material it needs to build more of its most important tool, like delivering the right kind of metal to the tool maker.
Precisely. So NAC's primary superpower is its indirect antioxidant action by boosting GSH. But the sources also mention that NAC itself has that same sulfhydryl we talked about in GSH. This gives NAC a kind of dual nature.
Meaning it can also work directly, like zap those RONS itself.
It can, yeah, but this is where things get a bit debated, according to one review article. That SSH group on NSC can directly scavenge certain RONs. The sources list molecules like the hydroxyl radical, nitrogen dioxide, and others, and they even provide technical rate constants showing these reactions can be quite fast.
Okay, so it can directly neutralize some bad guys. What's the debate then? Why isn't that the main story?
Well, the debate is about how physiologically relevant this direct scavenging is compared to its main role of boosting GSH. The sources point out that while NAC reacts quickly with some RONs, it reacts much slower with other common ones like superoxide or hydrogen peroxide.
Okay.
Plus, inside a cell, there are vastly higher concentrations of other molecules and enzymes involved in RONus neutralization, like GSH itself, or enzymes like superoxide dismutase. So, under typical physiological conditions, NAC's direct scavenging might be less impactful than the widespread antioxidant power you get from significantly increasing GSH levels throughout the cell. Think of it this way. NAC's ACSH group might be a decent individual cleaner, maybe good in specific spots, but its real power is hiring and equipping an entire sanitation crew, which is GSH.
That's a great analogy. Okay, so the indirect effect through GSH is likely the main story, the big impact, but the direct action is still a potential mechanism, even if its importance is debated. Are there other ways NAC acts at a molecular level mentioned in the sources?
Yes, the sources mention a few others. It can modulate the redox state of certain neurotransmitter receptors, specifically the NMDA and AMPA receptors in the brain. This is pretty complex, but simply put, it can influence how these receptors, which are involved in learning, memory, and even addiction, function based on the local chemical environment.
Interesting. Neurotransmitter effect.
Yeah, and it also has effects on inflammation, notably by inhibiting a key pathway called NFE, which plays a central role in telling cells to produce inflammatory signaling molecules called cytokines, so it can potentially dial down inflammation.
And I remember you mentioned something about it binding to metals earlier. Does it clean up heavy metals?
Right. NAC can bind to certain metal ions, both necessary ones like copper and iron, which can become problematic in excess or in the wrong state, and toxic heavy metals like cadmium, mercury, and lead. It forms complexes with them.
So it acts like a chelator.
It can bind them, yes, but the sources note that while this metal binding property is observed, the clinical evidence for NAC's effectiveness, specifically as a chelator, a substance used mainly to remove heavy metals from the body, is considered limited and debated, especially when you compare that potential effect to the protective effects offered by its GSH boosting role in combating the oxidative stress caused by those metals.
So even in cases of metal toxicity, its benefit might still be more about helping the body cope with the damage the metals cause via oxidative stress, rather than primarily binding and removing the metals themselves.
That seems to be the nuance presented in the sources, yeah. It's a compound with layers of potential mechanisms, but boosting GSH keeps coming up as the central pillar, the most robust effect.
And this complex molecule isn't a recent discovery. It feels like it's everywhere now, but it's been around.
Not at all. It's been in use for over 50 years. It's recognized by the World Health Organization and is on their list of essential medicines, available as an inexpensive generic drug. And yes, it's also widely accessible as an over-the-counter supplement in many countries, including the US, Canada, and Australia. That long history and accessibility are key to why it's been studied so much and used so widely.
Okay, that gives us a really solid foundation on what NAC is and how it primarily works. Now, let's take that understanding and apply it to one area where it gets a lot of attention: sports performance. Here's where it gets really interesting. We have a couple of sources that dive into this, and they show how challenging it is to translate those fundamental mechanisms into clear performance benefits.
Absolutely. It's a great illustration of the gap that often exists between theory and practice in supplementation research. Let's start with that 2011 study by Leelor and Grayab and colleagues that specifically looked at short-term NAC supplementation in sedentary men.
Sedentary men, that seems counterintuitive for a sports performance study. Why start there?
Well, it's a specific population, and it matters. They wanted to see if NAC could improve baseline exercise capacity and tolerance to oxidative stress induced by exercise in individuals not accustomed to it. Sort of see if it helps people get started, perhaps.
Okay. So what was the setup?
It was a randomized controlled trial with 29 sedentary men, 13 in the control group getting a placebo, 16 in the supplement group. They gave the supplement group 1,200 milligrams of oral NAC daily for just 7 days.
Just a week. That seems short. What did they measure after such a brief period?
They looked at several markers related to exercise performance and stress. They measured muscle fatigue using a specific quadriceps test looking at something called the fatigue index, where a higher percentage means less fatigue. They measured maximal oxygen uptake, VO2 max, during a graded treadmill exercise test.
VO2 max, a classic endurance marker.
Exactly. And they took blood samples before and 20 minutes after the exercise test to check levels of total antioxidant capacity, TC, lactate, creatine kinase, CK, and tumor necrotic factor alpha, TNFC.
Okay, quite a few markers. So after only 7 days on 1,200 milligrams, What happened with these sedentary guys taking NAC?
For the men taking NAC, the results were quite striking in some areas. They saw a significant increase in their fatigue index, meaning their muscles were less fatigued during the test, improving from about 81% to over 90%. That's a pretty decent jump.
Less muscle fatigue, okay. What about the VO2 max?
That also went up significantly. Their VO2 max improved from around 38 to 41 milligauge. Critically, it's noteworthy that the control group's VO2 max actually slightly decreased over the same week, though not significantly.
Wow, so for sedentary guys, a week of NAC seemed to improve both muscle fatigue tolerance and aerobic fitness. That sounds like a potential ergogenic benefit right there, at least for that group.
It certainly points in that direction for this specific population and time frame. The improvements in fatigue index and VO2 max were statistically significant within the NAC group and different from the control. Now, let's look at those blood markers after they did the exercise test.
Right, the stress markers.
Yeah. When the control group exercised after the week, their TAC decreased, showing their antioxidant reserves got used up, and lactate, CK, and TNF all increased significantly. That's pretty typical. Metabolic stress, muscle damage marker, inflammation marker, all going up.
And the NAC group, did they avoid all that?
This is where it gets nuanced, like you said. In the NAC group, after supplementation, exercise did not cause significant changes in TAC or lactate levels compared to their pre-exercise levels.
So it helped maintain antioxidant status and control lactate.
That's what it suggests, yeah. It helped them maintain their antioxidant capacity and seemed to control lactate production during that exercise stress. However, CK and TNF did still increase significantly after exercise in the NAC group, just like in the control group.
Huh. So it helped with metabolic stress markers like lactate and overall antioxidant status, but not the markers often associated with muscle damage, CK, and inflammation, and TNF.
Exactly. The study authors highlighted this mixed result. They suggested that perhaps short-term NAC doesn't significantly impact muscle damage or systemic inflammation markers in the same way it affects antioxidant status and lactate. Maybe those pathways take longer to influence.
Interesting point.
They even referenced earlier work where a longer NAC treatment, like 3 months, did decrease TNSO, implying that duration might be crucial for influencing those inflammatory pathways.
That distinction is really important. It might protect you from the metabolic consequences of stress, but not necessarily from the physical damage or inflammatory response, at least not in the short term. What else did they find in that study? Any other measures?
Yeah, they reported that baseline characteristics were similar between groups. Blood counts were healthy. Resting heart rate decreased slightly, but significantly in the control group over the week, but not in the NAC group. And perceived exertion, RPE, how hard the exercise felt, was lower in the NAC group at the end of the study compared to their own baseline. It was also lower compared to the control group at the end, although this specific comparison between groups at day 8 wasn't statistically significant.
Still, subjectively feeling less fatigued or like the exercise is easier can certainly influence performance, even if the stats don't fully capture it.
Absolutely. How you feel matters.
So for a sedentary person, 7 days of 1,200 milligram oral NAC showed promise in improving objective markers of general aerobic endurance and fatigue tolerance, alongside subjective reports of lower exertion, while helping manage exercise-induced changes in TAC and lactate.
That's a fair summary based on this specific study. The question it raises, of course, is, could these effects be even more pronounced in trained individuals who are pushing their bodies harder and potentially generating more oxidative stress during intense training? This single study in sedentary men can't answer that directly, but it provides a starting point.
Right. Different population, different context, maybe different needs. Let's broaden out using the review articles and that more recent 2024 study you provided in Applied Sciences. What do they tell us about NAC in active or trained individuals?
Well, the review articles confirm that NAC is commonly investigated as an ergogenic aid, a performance enhancer, but they immediately point out the significant variability and mixed results across different studies. It's not a clear-cut picture.
Why so mixed?
They attribute this largely to the heterogeneity of the research, basically. Studies were just all over the place. They used different exercise types, endurance, strength, intermittent, different populations, recreational athletes, elites, different doses. And this is wild, from 1.2 grams up to 20 grams per day.
20 grams, that's a huge dose.
Massive. And different durations from days to months, and critically, different administration routes, oral versus intravenous.
Does route of administration make a big difference for performance?
According to the reviews, yes, it likely does. Intravenous administration is often used in research, potentially for better, more reliable bioavailability. But obviously, oral is much more practical for everyday supplemental use. This difference alone could significantly impact results.
Okay, so what kind of results have been seen?
The reviews mention that some studies have shown substantial athletic performance increases, sometimes cited as up to 50% improvement, particularly during repeated bouts of intermittent high-intensity exercise, like sprints with short recovery.
Interesting.
These benefits seem more likely in athletes where ROS generation, that oxidative stress, is high, or perhaps when starting from a pre-fatigue state. But as you noted, other studies found no performance improvement, even under fatigue conditions.
So it might not be a universal performance enhancer, but maybe beneficial in specific types of demanding exercise,
Yeah.
particularly repeated efforts.
That's a potential interpretation of the mixed findings presented. Which brings us neatly to that 2024 study. This one used oral NAC, a higher dose, 2,400 milligrams daily for 8 days in physically active individuals. So, different population than the sedentary men.
And different kind of test, right?
Yeah, their approach also differed. They used a fatigue protocol focused on repeated maximal isometric contractions of the knee extensors, like pushing against an immovable object as hard as possible over and over.
Okay.
They assessed maximal voluntary isometric contraction, MVC, basically peak strength in that position before, immediately after the fatigue protocol, and then again 24 hours later to look at recovery.
And did the NAC group show better peak strength or faster recovery after that tough isometric fatigue test?
This is where it aligns with some of those no performance improvement findings from the reviews. The study found that oral NAC supplementation did not significantly improve maximal isometric contraction force, MVC, either immediately after the fatigue protocol or 24 hours later, compared to the control group or their own baseline before supplementation.
Huh. So no boost in peak strength or standard recovery measures here. Unlike the earlier study showing aerobic improvements in sedentary guys, this higher dose didn't boost peak isometric strength or recovery in active individuals. What did they find then? Was there anything?
This is where the nuance comes in, reflecting that idea of perhaps delaying fatigue rather than boosting peak output. The study did find a significant difference in the loss of isometric force during the fatigue protocol itself.
How so?
Okay, so they compared the results after supplementation to the results before supplementation within each group. The fatigue protocol involves 7 sets of 10 contractions. Naturally, your force production drops as you do more sets, right? You get tired.
Yeah. Your muscles fatigue.
Exactly. They looked at when that force drop became statistically significant compared to the very first set. Now, in the NAC group, after they took the supplement for 8 days, their strength loss compared to the first set became significant from set 4 onwards. But critically, compared to their own baseline performance before taking NAC, the strength loss during the protocol from set 4 onwards was significantly less after taking the supplement.
Okay.
In the control group, that significantly less strength loss compared to their own baseline only occurred from set 5 onwards after their placebo supplementation.
Hang on, let me get this straight. The NAC group showed less strength loss sooner than the control group compared to their own baseline.
Let me rephrase that based on the author's interpretation. They interpret it as the NAC group maintained force production better for longer. The point at which the decrease in force compared to the initial maximum became significant happened slightly later in the sequence of sets for the NAC group, from set 5 onwards reaching maximum decrease, compared to the control group, from set 4 onwards reaching maximum decrease. Let me double check that detail. Yes. The authors state, NAC group reached their maximum decrease in force production slightly later, from set 5, compared to the control group, from set 4.
Okay, so the NAC group held on to their strength slightly better during the repeated sets. They fatigued a bit slower.
That's the interpretation provided by the study authors, yes. They concluded that the 8-day, 2,400 milligram oral NAC supplementation delayed the onset of fatigue effects on force production during these repeated isometric efforts.
And what kind of sports might that apply to?
Well, they suggest this relates to working at submaximal intensities close to the lactate steady state, and that such a delay in fatigue onset could translate to performance benefits in repeated gesture sports or activities involving sustained high-intensity effort.
So maybe not for powerlifting or a single max lift, but potentially for something like repeated jumps in basketball, grappling in combat sports, or intense interval training sessions, things where you have to keep going.
That's the type of scenario their findings might be most relevant to based on their interpretation. They also speculate, drawing from other research mentioned in the reviews, that NAC might reduce perceived pain. and that feeling less discomfort could contribute to the ability to push through more repetitions or sustain effort longer, even if the objective force production isn't completely maintained. Their study didn't measure pain, though, so that's just speculation.
That makes intuitive sense. If you feel less pain or discomfort, you might tolerate fatigue better, push harder for longer. What about safety at that higher 2,400 milligram oral dose used in the 2024 study? Any issues?
This study reported that 2,400 milligrams of oral NAC daily for 8 days appeared safe with minimal side effects. They specifically listed the side effects observed, which were very few and had low percentages. Things like nausea, which is pretty common with oral NAC, maybe some itching, minor local reactions. Notably, there was no significant difference in the frequency of side effects between the NAC and control groups in this particular study.
Okay, so summarizing the sports picture from these sources. A lower dose, 1,200 milligrams, for a week showed promise for improving general aerobic endurance and fatigue index in sedentary individuals.
Yeah.
A higher dose, 2,400 milligrams, for 8 days in active individuals didn't seem to boost peak strength or recovery, but suggested it could help delay fatigue onset during repeated high-intensity efforts.
Right.
And the overall consensus from the reviews is, well, mixed evidence. Heavily dependent on the specific context, the exercise type, who's doing it, the dose, the duration, but with some promising signals, particularly for activities involving sustained or repeated bouts of effort or oxidative stress likely builds up.
Exactly. It's definitely not a simple take NAC, get stronger faster story based on this material. It's much more a nuanced picture of potential benefits in specific scenarios, likely tied back to its ability to support cellular resilience during stress, probably via GSH.
The sports applications are intriguing, but as you mentioned earlier, NAC has a much longer, more established history in medicine. Let's shift gears dramatically to its medical uses, both proven and those still under investigation. What's fascinating here is, well, just the sheer breadth of conditions where NAC is either a standard treatment or being actively researched. It's kind of amazing.
This is where NAC truly moves from potential supplement to indispensable medicine in certain contexts. The sources highlight 2 primary, well-established medical uses. The first is its critical life-saving role as an antidote for paracetamol poisoning. You probably know paracetamol as acetaminophen, like in Tylenol.
This is a major one, right? Like, it's on the WHO Essential Medicines list specifically for this.
Absolutely. Paracetamol overdose is a major cause of acute liver failure. The drug itself isn't inherently toxic at normal doses, but a large overdose overwhelms the body's detoxification pathways, particularly the pathway that uses GSH. This leads to the accumulation of a highly toxic metabolite called NAPQI.
NAPQI, okay.
This NAPQI stuff binds to liver proteins and causes severe damage and cell death. It's really nasty.
And NAC saves the day here. How does it counteract that?
In this specific scenario, NAC primarily works by directly providing the cysteine needed to rapidly synthesize massive amounts of GSH right there in the liver. By replenishing GSH, the liver can conjugate and detoxify NAPQI before it causes irreversible damage. It also has other effects, like improving oxygen delivery to the damaged liver cells.
So it helps the liver clean up the mess.
Pretty much. It's universally accepted as safe and highly effective for preventing liver failure if administered in time after a paracetamol overdose. Timing is critical, though.
And the sources even mentioned updated clinical protocols for this, like how doctors give it.
Yes, one review details updated clinical guidelines for intravenous, or IV, administration. The standard IV protocol for paracetamol poisoning has been refined from a previous 3-bag regimen to a newer 2-bag protocol.
Simpler is usually better if it works just as well.
Right. It involves a loading dose of 200 milligrams over 4 hours, followed by 100 milligrams over 16 hours. The sources note this revised protocol has similar efficacy to the older one, but significantly reduces the incidence of adverse reactions, particularly those anaphylactoid reactions, which can happen with high-dose IV NAC. They also specify a maximum weight limit of 110 kilograms for dosing in adults to avoid administering excessively large amounts.
Okay, makes sense. That's a clear, specific life-saving application.
Yeah.
What's the other well-established use? You mentioned 2.
The other is as a mucolytic agent. Basically, it helps break down mucus. NAC is used in various respiratory conditions characterized by thick, sticky mucus, things like COPD, cystic fibrosis, acute and chronic bronchitis, pneumonia.
How does it do that?
It works because its sulfhydryl group, -SH, breaks the disulfide bonds that hold the mucus proteins together, kind of like molecular scissors cutting the sticky links. This reduces the viscosity and elasticity of the mucus, making it thinner and easier for patients to cough up and clear from their airways.
Ah, okay. So it physically changes the mucus.
Exactly. It's FDA approved for use in bronchopulmonary disorders and has been used for this purpose for decades, often administered via nebulizer, inhaled directly into the lungs, or sometimes even orally.
So established roles as a liver protector in poisoning and as a mucus thinner for lung conditions. But looking at the scope of conditions listed in the sources and the clinicaltrials.gov data,
Yeah,
the list of areas being investigated is enormous. It's way beyond just those two.
it truly is. The sheer volume of research suggests NAC's potential is being explored across almost every field of medicine, largely driven by that foundational role in GSH synthesis and its influence on oxidative stress and inflammation. Let's maybe run through some of the major areas highlighted in your sources.
Pulmonary diseases seem like a natural extension of its mucolytic use. COPD, for instance.
They are, but the clinical results for conditions like COPD beyond just thinning mucus have been somewhat controversial, or maybe just mixed. The sources point out that some clinical trials using lower doses, like 600 milligrader, did not show significant benefits on objective measures of lung function, like FEV1, that's forced expiratory volume in 1 second, a key breathing measure, or on reducing exacerbations, those flare-ups that land people in the hospital.
So lower doses didn't do much for the underlying disease.
It seems not, based on those studies. Even a short-term high-dose study, 3,600 milligram per day for 8 weeks, didn't show general respiratory benefits.
That seems to contradict its recognition in some guidelines, though.
Well, it highlights that complexity again. However, the reviews also mention that meta-analyses and other studies suggest that higher doses, 1,200 milligram per day or long-term use, 6 months, can safely reduce the risk of COPD exacerbations, even if lung function parameters like FEV1 aren't improved.
Ah, so it might not reverse the lung damage or improve daily breathing capacity, but it could help prevent those acute, severe episodes, less flare-ups.
That seems to be the takeaway. It might help stabilize things, reduce the frequency of worsening. The Global Initiative for Chronic Obstructive Lung Disease, GLLD guidelines, do recognize it as an adjunct therapy specifically for exacerbation reduction, though the evidence level cited is B, suggesting moderate evidence, not super strong A-level evidence.
Okay. Still potentially useful for some COPD patients, then. What about other lung conditions?
It's also being investigated in other serious lung conditions like cystic fibrosis, where mucus is a huge problem, and idiopathic pulmonary fibrosis, which involves scarring of the lungs.
How about cardiovascular diseases? The sources mentioned heart attacks and surgery.
Yes, it's been investigated in acute myocardial infarction, AMI, or heart attack. Some studies, particularly those using high-dose intravenous NAC, we're talking around 15,000 milligrams over 24 hours, so a lot often in combination with other standard treatments like nitroglycerin and clot-busting drugs, have shown benefits.
What kind of benefit?
These studies reported reduced oxidative stress markers in the blood, like improvements in the GSH-GSSG ratio and reduced MDA, a marker of lipid damage, and even improved function of the left ventricle, the main pumping chamber of the heart, after the heart attack. NAC is also thought to potentially enhance the effects of nitroglycerin, which helps relax blood vessels.
So promising for heart attacks, maybe in that specific high-dose 5E context?
Potentially, yeah, in specific treatment regimens combined with other therapies. However, when we look at broader applications, like in cardiac surgery patients, where oxidative stress is also a big factor from the surgery itself. Well, a systematic review mentioned in the sources found that NAC, used at various doses and routes around surgery, did not demonstrate significant efficacy in reducing major adverse outcomes, things like mortality, acute renal failure, heart failure, or the need for prolonged ventilation.
So again, mixed results. Works in one heart scenario, maybe not another.
It really underscores that benefits can be highly context-dependent. The specific stress, the timing, the dose, the route, it all seems to matter immensely.
And the list of neurological and psychiatric disorders being investigated is incredibly long. Parkinson's, schizophrenia, addiction, Alzheimer's.
It's one of the most active areas of current research, definitely. This reflects the brain's high metabolic activity and vulnerability to oxidative stress and inflammation, and also the role of neurotransmitter systems that NAC might influence, like we touched on with the NMDA receptors.
So what conditions are they looking at?
The list is huge. Parkinson's disease, schizophrenia, bipolar disorder, a wide range of addictions, alcohol, tobacco, cocaine, cannabis, Alzheimer's disease, multiple sclerosis, age-related memory impairment, even neuropathic pain.
Are there any consistent signals emerging in that vast field, or is it mixed there too?
Well, there are some interesting findings, but like other areas, results often vary. For Parkinson's disease, some smaller studies have shown promise. A single high-dose Adivelae NAC administration was shown to increase GSH levels not just in the blood, but actually in the brain.
Getting it into the brain is key there.
Absolutely. And another study protocol combined weekly high-dose IV infusions with daily oral NAC, and it suggested positive effects on the dopaminergic system, the system affected in Parkinson's, and improved clinical outcomes in patients.
That sounds positive.
It does, but contrast that with a trial using a high oral dose alone, 6,000 mg a day. That study found it increased blood antioxidants but failed to increase GSH levels in the brain.
There's that bioavailability issue again. Oral just might not get enough into the brain compared to IV.
That's what that specific finding suggests,
Yeah.
based on the sources, yeah. It really highlights that crucial point about route of administration, especially for reaching specific tissues like the brain, which has the blood-brain barrier.
What about other brain-related conditions? Cognition? Addiction?
More broadly, a meta-analysis is mentioned suggesting a positive effect of NAC on human cognition, covering both healthy individuals and those with mental illness. Its previously mentioned ability to modulate NMDA receptors is thought to be relevant here, perhaps playing a role in conditions like addiction or disorders affecting thought processes. And there are preclinical studies in animals and cells supporting neuroprotective roles against age-related cognitive decline and protection against metal-induced damage in the brain. This suggests potential for conditions like ALS, Alzheimer's, mild cognitive impairment, and general memory issues.
So lots of potential, but still needing more robust human data, especially considering the delivery challenges.
Exactly. Lots of avenues being explored.
What about other organs or systems? You mentioned liver disease beyond paracetamol poisoning.
Right. It's being investigated in acute liver failure caused by other factors, like viruses or other drugs. Also, non-alcoholic fatty liver disease, NAFLD, which is increasingly common, and acute alcoholic hepatitis. For these non-paracetamol causes, the sources state the mechanisms are less clearly tied to that specific GSH depletion pathway seen with paracetamol. Potential benefits might be related more broadly to optimizing oxygen supply to the liver and improving overall systemic blood flow and function, reducing general stress on the organ.
And kidneys. I saw a lot of kidney studies mentioned in the materials. Seems like a big area of focus.
Yes, there's been extensive research, particularly into using NAC to prevent contrast-associated acute kidney injury, or CAAKI. This is kidney damage that can occur after certain medical imaging procedures that use contrast dye.
Does work for that.
Unfortunately, the results in this area have been largely disappointing according to the sources. Several large, well-conducted trials were terminated early due to a clear lack of benefit. It just didn't seem to prevent kidney injury in that context.
That's surprising given the link to oxidative stress.
It is. And similarly, a pediatric study looking at oral NAC for acute pyelonephritis, which is a type of kidney infection, also found no benefit after 5 days. The authors there speculated that the duration might have been too short to significantly impact the inflammatory markers relevant to that specific condition.
So despite the theoretical link to oxidative stress in kidney injury, it hasn't panned out clinically in those specific areas yet. What about infectious diseases? Any traction there?
The sources discuss its potential here largely through its ability to attenuate oxidative stress and inflammatory mediators, which are often involved in the body's response to infection and can sometimes contribute to tissue damage-friendly fire, essentially.
Makes sense.
Studies in chronic hepatitis B showed that high IV doses improved liver function markers. In pulmonary tuberculosis, oral NEC supplementation was found to reduce sputum viscosity, making it easier to clear, and also improved some markers of immune response and radiographic findings on chest x-rays.
And what about newer infections, COVID-19?
Critically, given recent events, yes, it's been under intense investigation for SARS-CoV-2 or COVID-19. Research explored its potential roles in multiple ways.
Like what?
Potentially blocking viral entry into cells by interfering with the ACE2 receptor, which the virus uses. Its well-known antioxidant effects to combat the massive oxidative stress caused by the virus and the body's immune response, the so-called cytokine storm. And its anti-inflammatory actions via NF-fup inhibition, potentially reducing the severe inflammation and lung damage seen in severe COVID-19 cases.
So applying all those mechanisms we discussed earlier directly to this new health crisis.
Exactly. Trying to leverage its known properties against a new threat.
Wow. What other areas are listed? It seems endless.
The tables and text in the reviews touch on a really wide array. Potential roles in gastrointestinal issues like H. pylori infection, maybe colon cancer prevention, and ulcerative colitis. used as an adjunct therapy in cancer treatment, particularly alongside radiation therapy to potentially protect normal tissues. Smoking cessation, male fertility issues, sickle cell anemia, preeclampsia, a serious condition during pregnancy.
And metabolic syndrome, too.
Yeah, a pilot study mentioned showed benefits on insulin resistance, inflammation markers, blood pressure, and triglycerides in people with metabolic syndrome, and even various ocular conditions like blepharitis, eyelid inflammation, and meibomian gland dysfunction related to dry eye.
It's just, wow. If we connect this back to the bigger picture,
Yeah.
it really drives home that NAC is being explored for almost anything where oxidative stress or inflammation is thought to play a significant role. Its ability to boost GSH seems to be the central reason for this vast research effort.
Exactly. The sheer volume and diversity of clinical trials reflect the fundamental importance of maintaining cellular redox balance and controlling inflammation for overall health. NAC, by acting as a cornerstone for GSH synthesis, becomes a natural candidate for investigation in conditions where these processes are dysregulated.
But as we've repeatedly seen across different areas.
Moving from that theoretical potential to proven clinical efficacy is challenging. The results are often conflicting or context-dependent, requiring very careful consideration of the specific condition, the population studied, the dose used, the duration of treatment, and importantly, that route of administration, oral versus IV. It's rarely straightforward.
It's clear NAC is incredibly versatile, but definitely not a simple panacea. This brings us to some critical considerations and potential controversies highlighted in the sources. Things people should be aware of.
Yes, despite its proven benefits in specific medical scenarios and its generally good safety profile, especially when taken orally, there are nuances and potential risks that need careful consideration, particularly when we think about broader long-term use or use outside of clear medical indications.
Like what? You mentioned something earlier about it potentially being pro-oxidant.
Yeah.
That still sounds counterintuitive after talking so much about it being an antioxidant through GSH.
It is, and it illustrates that the line between antioxidant and pro-oxidant can sometimes be blurry, depending on the chemical environment. The sources state that at very high concentrations, or critically, in the presence of certain transition metals like iron and copper, which are common in the body, NAC, can actually act as an oxidant. It can reduce these metal ions, but then those reduced metal ions can drive reactions that produce harmful RONs through mechanisms like Fenton chemistry. It can also generate potentially damaging thiol radicals from its own structure under certain conditions.
So too much of a good thing, especially with certain metals around, could actually increase damaging molecules instead of decreasing them.
Potentially, yes, in specific circumstances. This is why maintaining redox balance is the goal, rather than just blindly pushing antioxidant levels as high as possible. These pro-oxidant effects could also, theoretically, interfere with important cellular signaling pathways that rely on temporary controlled oxidative bursts to function correctly.
That's a crucial caveat. Okay, what about general safety and toxicity data presented in the sources? How safe is it generally?
Oral NSC is generally considered to have an excellent safety profile. The most commonly reported side effects are mild gastrointestinal symptoms, things like nausea, vomiting, sometimes diarrhea, or an unpleasant sulfur taste or smell, usually not serious.
But NAV is different.
Yes. As mentioned when discussing paracetamol poisoning, parenteral or intravenous, administration carries more significant risks. The sources highlight the possibility of anaphylactoid reactions. These are adverse reactions that resemble severe allergic reactions, anaphylaxis. They can include skin rashes, hives, intense itching, flushing, sudden drops in blood pressure, hypotension, wheezing, and difficulty breathing.
That sounds serious.
They can be severe and, though rare, have been fatal. The risk seems higher in patients with asthma or those receiving rapid infusions of high doses, so 4V-NEC requires careful medical supervision.
Any other side effects mentioned?
Inhalation, like from a nebulizer, can also cause increased airway obstruction in some individuals, particularly those with asthma. And the sources also mention reports of severe acute toxicity from massive overdoses. There was a tragic case cited resulting from a 100-gram IV dose given due to an administration error.
100 grams, that's enormous.
Astronomical. It led to hemolysis, red blood cell destruction, thrombocytopenia, dangerously low platelets, acute renal failure, and death. Even in a patient without a pre-existing condition like G6PD deficiency that increases sensitivity to oxidative stress. While this is an extreme accidental case, it underscores the potential for severe acute toxicity at very high doses, though Typical therapeutic doses are far, far lower.
Are there known drug interactions people should be aware of?
Yes, the sources mention that NAC can interact with certain medications. It might reduce the excretion of some drugs, potentially increasing their levels, or alter the bioavailability or serum concentrations of others. Its own effectiveness might also be reduced by certain antibiotics or enzymatic preparations. So, as with any supplement or drug, checking for interactions is important.
Okay, now let's talk about clinical trial terminations. The list in the sources mentioned reasons beyond just lack of funding or poor recruitment. Some were stopped due to no improvement or even opposite results.
Correct. That happens in research. Sometimes things don't work, or worse, seem to make things worse. And one specific instance highlighted in the sources is particularly relevant, I think, to the idea of long-term supplementation and potential risks. A large clinical trial looking at high-dose NAC in COPD patients was prematurely terminated due to a safety signal.
A safety signal from the trial itself.
Not directly from that specific human trial, interestingly. The decision was prompted by findings from a separate preclinical study.
What did that other study find that was so alarming?
The source states that this separate study showed that oral NAC, when given together with vitamin E, induced lung cancer in mice. This finding was also apparently reproduced in cell lines derived from human and mouse lung tumors.
Whoa, NAC and vitamin E together caused lung cancer in mice?
That's say.
Yeah, that's a serious red flag, especially when considering long-term use or people taking multiple antioxidant supplements.
It absolutely is. The source explicitly states that this finding in mice and cell lines led to the decision to terminate that specific large human COPD trial as a precaution. This raises a really important question about the complexity of antioxidant supplementation, especially high dose or in combinations, and potential unforeseen long-term effects.
It really challenges the simple antioxidants are always a good idea.
Exactly. Antioxidants play crucial roles in regulating cellular growth and death. Interfering with redox balance, especially chronically, could, in some contexts, potentially interfere with necessary processes like detecting and eliminating precancerous cells. That mouse study serves as a stark reminder that the long-term safety of high-dose, broad antioxidant supplementation, especially for preventive purposes or for something like anti-aging, is not fully understood and carries potential risks that need serious investigation.
That finding definitely puts the brakes on any simplistic idea that more antioxidants equals better health or anti-aging without solid long-term human safety data. Speaking of anti-aging, sources do touch on that hypothesis, right? It's often marketed that way.
They do. The idea of NAC having anti-aging potential is largely derived from promising preclinical studies. These were conducted in simpler organisms like worms or flies and in mammals like mice, as well as in human cells cultured in labs.
What did those studies suggest?
They suggested that NAC might extend lifespan or reduce markers of aging in those model systems. The proposed mechanisms include activating telomerase, an enzyme that maintains the ends of chromosomes, which shorten with age, inhibiting apoptosis or program cell death, and of course, reducing oxidative stress by boosting GSH, which tends to decline with age.
But these are lab and animal studies mostly, not human trials showing people live longer taking NAC.
Precisely. These findings have yet to be replicated in humans. And again, it ties back to that caution we just discussed. Antioxidants can influence lifespan, but the effect can depend heavily on the dose, the timing, and the baseline state of redox balance, potentially lengthening it or potentially shortening it under certain circumstances.
So it's not straightforward.
Not at all. Long-term, high-dose use of any antioxidant, including NAC, specifically for anti-aging purposes in humans, would require extensive long-duration safety data that, based on these sources, is simply not fully available yet, especially in light of concerning signals like that mouse study involving NAC and vitamin E.
It makes theoretical sense that boosting GSH, which declines with age, could combat age-related oxidative stress. That part seems logical.
It provides a strong theoretical rationale for investigating its anti-aging potential, absolutely. But translating that theory and promising initial findings from simple systems to safe and effective long-term use in complex human aging is a massive leap. It requires rigorous clinical research and a complete understanding of potential long-term risks, which we don't fully have yet.
This has been a truly deep dive covering everything from the microscopic workings of NAC to its use in life or death situations, its exploration in peak performance, and grappling with these complex safety questions and mixed results. So what does this all mean for you, the listener, trying to make sense of this compound based on these sources?
Yeah, pulling it all together. Based on the sources you provided, we can distill a few key takeaways. First and foremost, NAC's power stems primarily from its role as a highly effective precursor for your body's most abundant and critical intracellular antioxidant, glutathione. Supporting GSH synthesis is fundamental to cellular health and is really the common thread behind its diverse potential applications.
And it has undeniable, proven, life-saving medical uses. That's not in question.
Absolutely. Its role in paracetamol poisoning and as a mucolytic agent are established, effective, and safe when used appropriately under medical guidance. These are solid applications.
But for many of the other potential uses in sports, for neurological conditions, various other diseases, or anti-aging,
That's where the picture becomes much more complex, and based on the sources we looked at, often shows mixed clinical trial results. While the potential seems high, driven by its mechanisms, robust clinical evidence for widespread efficacy is still lacking or conflicting for many conditions. It's definitely not a guaranteed benefit across the board for all those other things.
and how you take it really matters. That came up again and again.
Critically so. The sources highlight that the bioavailability, how much gets into your system and where it goes, and therefore the effectiveness can differ significantly between oral and intravenous administration. That likely impacts outcomes depending on where in the body you need NAC or GSH to be active, like getting into the brain versus just boosting liver levels.
Finally, while generally safe orally, it's not entirely without risk. And long-term effects, especially at high doses or in combination with other things, warrant caution.
Correct. Oral side effects are usually mild, mostly GI stuff. But IV administration carries more serious potential risks like those anaphylactoid reactions. And that cautionary signal from the mouse study about potential long-term issues, particularly when combined with other antioxidants like vitamin E, reminds us that we still have much to learn about the complex interplay of these compounds in the body over extended periods. It's not something to be taken lightly long-term without good reason.
So NAC emerges from these sources as a really fascinating compound. It's kind of a bridge between established medical therapy and exploratory supplementary use, and its potential is deeply tied to supporting a fundamental aspect of cellular health, glutathione.
It's a powerful example of how understanding a molecule's core mechanism can open up vast avenues of research, but also how challenging it is to translate that potential into reliable benefits across diverse conditions and complex human systems. The science is still evolving rapidly for many applications.
Which leaves us with a final provocative thought for you, the listener, to consider. Given the often conflicting clinical results for many potential uses of NAC that we discussed, but the consistent evidence that it effectively boosts cellular GSH, how might you evaluate the potential benefits of supplementing with NAC for a specific personal goal compared to other strategies, things like optimizing your diet, exercise, sleep, stress management, maybe other lifestyle factors that also naturally support your body's own production and maintenance of cellular antioxidant capacity, including glutathione?
That's a really good question. It's about weighing the direct intervention against supporting the whole system, a question worth deep reflection.
Indeed. Well, thank you for providing the sources that made this deep dive into N-acetylcysteine possible. We hope this conversation has given you a more informed and nuanced perspective on this incredibly versatile and sometimes confusing compound.
Yeah, hopefully helpful. Continue exploring. The journey of understanding never truly ends, especially with molecules like this.
We'll be back soon with another deep dive.